out that your paycheck may have an impact on your heart health. Over the course of nearly 2 decades, researchers found that people whose income dropped by 50% or more were 17% more likely to have a fatal coronary heart disease, stroke, or heart attack. While those whose income went up by 50% were 14% less likely to have a cardiovascular event. With a closer look at this now, we are joined by CBS News medical contributor Dr. Narula. She's a cardiologist based here in New York. So this is really interesting. And as I was reading it, I was trying to guess all the possible reasons. And even as I was reading it here, I thought, well, who would have a drastic drop in their income? Maybe people who are retired, and so they're older. So give me sort of, what are the factors here that would contribute to this?
So we can't prove causally what the factors are. We can definitely make assumptions. And what's interesting about this is that we knew in the past that higher income was associated with lower risk of cardiovascular disease, but we didn't know what changes in income really did.
Right.
And so you were guessing before, and you were right with a lot of your guesses. So we think that maybe some of the drop in income causes people to maybe choose less healthy foods. The stress may cause them to choose less healthy social behaviors like smoking or drinking. They may become depressed, and we know that depression is linked with coronary artery disease. All of these things, less working out or exercise, maybe they don't belong to a gym anymore, they've lost their health insurance. So there are a lot of factors that might play into why a loss of income could raise your risk of cardiovascular disease.
Right, and sort of the lesson that I'm getting from this is that, you know, you may find yourself in a dramatically different situation when it comes to income, but don't forget about your health. There are little things that you can do to maintain your health, right?
Well, one of the great things about cardiovascular disease, and we try to educate people about all the time, is that 80% of it is preventable, and it's preventable by lifestyle factors. Things like eating a healthy diet, exercising, controlling your stress, making sure that your blood pressure, your cholesterol, your blood sugar are all in line.
Right.
So there are a lot of things that people can do, but yes, some of them require actively making those healthier choices, which can be difficult when you have less income.
Right, so but you might cancel your gym membership, but it doesn't mean you can't walk around the block a couple times or take the longer way. There are ways to sort of compensate for that.
Right, exactly, and you really do have to try to make those compensatory changes.
Yeah, if you don't have your health, I mean, we know, like, you know, your health is everything. So in terms of healthcare professionals, what's their takeaway?
I mean, I think we have to do a better job screening for this as part of our intake with patients and really assessing what is somebody's socioeconomic background and how might that be playing into the decisions that they're making. Because if we understand that, then we can really better approach them in terms of how we're going to care for them. So I think really understanding that this is a big factor will make us better able to really help them as physicians.
Ask those questions. Have you had a drastic change or whatever? When I see this, I think income inequality is a public health issue. Is that your takeaway?
You know, it is, and we know that it is, and we talk about things like food deserts, you know, and so there are a lot of things that we can do from a public health perspective to try to take away some of this inequality, and we can make huge public health strides if we really put money and, you know, effort into that arena.
You're smiling like you're like, I've said this so many times before.
It's unfortunate, you know. It's tough, and I think, you know, one of the other things just to mention though is while we may surmise that it could be loss of income affecting choices, I think you brought up before. Also, there may be things like, let's say somebody gets sick and they can't work anymore, so it's actually the illness that's increasing the risk and not so much the income change, right? Or maybe they've lost a spouse and their spouse was the primary breadwinner, and so that has dropped their income. You know, so there are other factors that may be playing in even outside of their own choices.
Very fascinating. Dr. Narula, thank you so much.